I was reading this post by Dr. Chris. He was talking about his friend who runs marathons, dozens of them. In the end, he couldn't outrun one blocked artery. This is a real story. This friend of his, a doctor in his 40s, doesn't smoke, doesn't drink, doesn't stay up late. No high blood pressure, no diabetes, no family history, slim, healthy, and he's literally a marathon runner. Honestly, if someone like him can end up in trouble, the rest of us probably already in line. He mentioned that a few years back, he started trying this keto diet to burn the fats more efficiently and have more endurance, right? One day, he just felt this slight discomfort in his chest. Not sharp pain, just like a stone pressing gently on the left side. It's weird, but nothing too dramatic. He did an ECG on himself. Looks normal, but something didn't feel quite right. He went for a stress test. This came back positive. Then he did a CT angiogram and it shows up, boom, severe blockage. He said he went blank for a second. I didn't even have any risk factors. How is my artery almost fully blocked? He got a stent put in the same week. There was no collapse, there was no heart attack, no fainting, but the doctor told him that if he had waited just a bit longer, it would become a full-blown heart attack. And the thing about heart attacks, they don't wait for your next medical appointment. Heart attacks are not just for the overweight or for the unfit. The heart is one hardworking muscle. It never gets to rest. Its own blood supply comes from the coronary arteries, and once they clog up, oxygen supply drops. And then this muscle starts dying. And the scary part is 1/3 of heart attacks come with no obvious warning. There's like no chest clutching like what we see in the movies, especially in people with diabetes. Their nerves are dulled, so they don't even feel pain. They just feel like tired, breathless, maybe a bit dizzy, or maybe they brush off as being too busy, whether it's too hot, but by the time they check, half the heart is already damaged. There's a name for such conditions called the silent infection. A lot of people, they don't find out until it's too late. Late as in an autopsy report. We always think heart problems equals to symptoms, but actually heart problems equals to screenings. Even if you are healthy, slim, eating well, if you are over 40, if your family has early heart disease, if you are under a high stress job, if you smoke, eat poorly, have diabetes, please get screened. Just the basic tests like blood pressure, cholesterol, sugar, ECG, stress test, CTA scan if needed, because just feeling okay doesn't mean your arteries are okay. Sometimes they are already narrowing, just haven't exploded yet. If it does happen, what do? You have 90 minutes to save your heart. Time is literally muscle. Never wait. Never try to bear with it. Never drive yourself to the hospital. Call an ambulance. Let them give you the oxygen, medication, and the fastest route to the hospital. Every minute counts. Every minute, part of your heart could be dying. And this doctor's friend, he stopped keto after that. He said, I thought I was eating smart, but I never even checked if my body could take it. And no, I'm not saying keto is bad diet, but any diet you follow blindly without monitoring or understanding your body is a gamble. Because eating clean doesn't mean your arteries are clean. Running marathons doesn't mean your heart vessels are clear. You can outrun many things, but not the artery you never thought to check. You may wish to read this article if you want to find out more, and do share this video along with your friends whom you think fits the profile that I mentioned.